Future people focus, have a great self-perception.
Dr. Carolyn Daitch, you're one of the leading hypnotherapists internationally, author of several books, including the Affect Regulation Toolbox, which was awarded Best Hypnosis Book by the Society of Experimental and Clinical Hypnosis in 2008. Why did you decide to work with overreactive clients or patients? Why did you decide to write about working with them?
Well, Caroline, about 15 years ago, I decided to have exit interviews when my patients were ending therapy. And I would ask them, what did you get most out of therapy? And the majority of them said they're less reactive. And because they were less reactive, life was easier. So I started thinking about reactivity and how overreactivity can make life so much more difficult.
So your book deals with affect regulation. What is affect dysregulation and why is it a problem?
Well, affect dysregulation is a state where you're actually flooded with emotion. You're overwhelmed. And when that happens, there's a disconnect between your midbrain that mediates emotion and your neocortex. So it's difficult for your kind of wise, rational mind to manage the emotionality. And then it becomes a big problem. People with affect dysregulation suffer from anxiety. They avoid situations that might be uncomfortable. They sometimes wear people out. It's hard on relationships because they tend to be what I call maximizers. They make, we have an expression called making mountains out of molehills. I don't know if you have a similar one in German, but they blow up things. And so they sometimes are very hard to work with and hard to live with, but most of all, they suffer. They suffer with such excessive emotionality.
And now your book, The Affect Regulation Toolbox, is being translated into German, so German therapists can benefit from your hypnotic and your practical and effective hypnotic interventions. Why is it important for therapists to have a toolbox of techniques?
Because you never know what's going to be helpful to someone. I like, in the toolbox, I think I have 31 techniques. Because sometimes if you're dealing with somebody, say, who's very into his or her body, you need techniques that are focused on the body. Mm-hmm. If you're dealing with somebody quite skeptical and wanting to be in control, you need cognitive techniques, help them trust that they are in control. So it's just like sometimes you need a hammer and sometimes you need a wrench, and sometimes you need a screwdriver. I think it's really, really important that you individualize treatment, whatever you're doing, to the given person at the given moment. And I never know, frankly, which tool is going to work. So I try and I ask, was that helpful? And sometimes people will say, well, it was a little bit helpful here in the office, but I couldn't use it well at home. So I think it behooves therapists to have a lot of different interventions to help their clients.
Would you mind giving us example of the different interventions? You mentioned maybe cognitive or maybe body focused. So what would be a body focused intervention or hypnotic intervention that you use?
Okay. Well, the first thing I like people to do is scan their body. It's really important for me to teach people to identify precursors to what I call emotional flooding. So just to be regularly scanning. And if you scan your body and then you notice that your heart is beating quickly or your hands are trembling, that might be a red flag for you to say, okay, I might be on the verge of flooding and I better take some time to self-soothe. So that's a technique that I like to use. Another technique that I like to use is something called the juxtaposition of two feelings. That's one of my favorite techniques. And what does that mean? Well, you can be nervous about something. You can be unconfident about something. But you can also remember that there were times that you got through difficulties. So a technique that I use frequently with people is to put the vulnerability or the anxiety, the worry in one hand, And the feeling of remembering past successes and competency, even remembering the posture that you had when you felt competent, and to hold that in the other hand, and then to bring the hands together and bring them to the heart, and to make a suggestion that you can be frightened and you can be trusting. You can be angry and you can be forgiving. You can feel discouraged and yet have some hope. And I have them put them together over their heart and take them in. Because the reality is that sometimes it's difficult to extinguish a worry or a fear. But you can have another thought, another feeling side by side. So that's one of my favorites.
You use hypnosis as part of your treatment of anxious people. Aren't people dealing with anxiety nervous or skeptical to go into hypnosis, to go into trance?
And typically, when I see a new person who knows that I do hypnosis and they suffer from anxiety, they'll say, you know, I'm going to try it, but I'm probably too nervous to be hypnotized. And I will say to them, you know, you might be surprised, because people with anxiety are actually very high hypnotizables. And they say, why? Well, in order to be a good hypnotizable, you have to have a good imagination. And people who are anxious have great imaginations. They imagine everything that can go wrong. The other thing that you need to have as a characteristic to be a good hypnotic subject is to have good focused attention. Now, the problem with anxious people is they have very narrow attention. They have rigid, focused attention, which actually helps the hypnosis. It makes them not flexible, it makes them worry more, it makes it difficult for them to stop ruminating about a concern, but it actually helps in the hypnotic state to focus attention rather than wander around in your mind. The other thing is that people who are anxious are very somatically sensitive. What do I mean by that? People with anxiety actually sense feelings more. And then to make their suffering worse, they scan for them. So they might notice a pain in their stomach. And they actually might have more pains in their stomach than people who don't suffer from anxiety. And then they observe that pain, they catastrophize, and they say, this pain in my stomach, well, my aunt had colon cancer. What if I have colon cancer? I have 2 young children. What will I do? And then they obsess on it and keep scanning, and then the anxiety heightens and the stomach ache gets worse. So back to answering your question, people who are anxious tend to be very sensitive to their bodies, which really helps in hypnotic interventions.
Other than hypnosis, what are other techniques that you found useful when dealing with people with anxiety or when treating people with anxiety?
Well, hypnosis is really an adjunct to other treatment. So you can use it adjunctively with any therapy. I like to use it adjunctively with cognitive behavioral therapy and mindfulness. So with cognitive behavioral therapy, what I might do is use hypnotic language and trance induction, and then use cognitive techniques. For example, one of the cognitive techniques that I use is postponement. So let's say you're worried about something. I would have you write down your worry on a piece of paper and put it in an envelope, and then make an agreement with me and yourself to wait until 8 o'clock this evening, or whatever time we agree upon, to take out your worries. Now, that's a classic cognitive technique, but it works better if combined with hypnosis. It works better because in hypnosis you can use your imagination. It kind of goes in more deeply than if you just talk about it. And I think the compliance is better as well if you visualize that you're going to do something. And that segues into mindfulness. Mindfulness is getting more and more popularity, and that's essentially letting your anxiety come up without judging it, without condemning it, just letting it be. And people with anxiety tend to live in the future, so they miss the opportunity of the pleasure of the moment. So with mindfulness, you just say, there's the worried thought. There it is. I may not like it. I may not want it, but I can handle it. and it's transient. Transient, just like a bus. Everything kind of comes and goes. So that I borrow from other approaches and integrate it with hypnosis and find it's more powerful.
What are the effects? You've already mentioned them a little bit, but what are the effects of anxiety on relationships?
I have a lot of interest in that. I mean, the reality is that anxiety doesn't live in a vacuum. If you're anxious, it touches everybody who loves you. And the problem with relationships when one person has anxiety is essentially they're speaking two different languages. I'm from Detroit, Michigan, and it's kind of the auto capital of the United States. And there are a lot of engineers in Detroit. So I see a lot of anxious women, although I see a lot of anxious men too, but a classic case would be an anxious woman who married an engineer. Why did she marry an engineer? Because he was logical. He could fix things. He seemed unflappable. It felt so good at first to be taken care of in that way. And then about a year later, the romance sort of fades away a little bit, and she says, oh, she's afraid of flying. And he responds with logic. I can't believe, Caroline, you're afraid of flying. You're an intelligent woman. You know there's rarely a plane accident. I can't believe it. And what is she feeling? She's feeling he doesn't get me. He doesn't get that it's not about logic. And the reality is that it isn't about logic. It's an emotional response from the midbrain. And the more that he tries to appeal with logic, the more lonely and isolated and misunderstood she feels. And then they begin to attack each other. Like, I can't believe, Caroline, you're not listening to reason. I can't believe it. I'm so frustrated. And then she feels more discouraged and more hopeless, and then they both walk away. I call that the appeal, the attack, and the retreat. And it happens in almost every relationship when one person has anxiety.
So you've just mentioned the couple, the engineer and his anxious wife. How would you work with them after the retreat phase? How would you get them to connect and to start understanding each other?
Well, the first thing that I do is I teach them about the basics of anxiety. So that, again, being sort of gender biased, let's say it's a man, I teach him about the brain. I teach them both about the brain, that there's a frontal neocortex and a midbrain and a hindbrain. And when we're flooded with emotion or fear, there's a little place in the midbrain called the amygdala that it's as if the midbrain has gone rogue. And I teach it to him and to her. And then I have an exercise called love of logic and emotion. And I have them imagine seeing each other's brain. He sees her midbrain lighting up in red, and she sees his cool brain. And then I have their words meeting each other and saying it's not that he doesn't love you, it's just that his cool blue brain doesn't understand your red brain.